facial figure. Optic nerve, ciliary ganglion, maxillary nerve, ophthalmic nerve, ganglion, mandibular nerve, posterior superior alveolar nerve, spinopalatine ganglion, nerve to muscles of mastication, long buccal nerve, lingual nerve, inferior alveolar nerve, anterior pateline nerve, mandibular foramen, greater palatine foramen, long buccal nerve, mental nerve, lacrimal gland, middle superior alveolar nerve, inferior orbital nerve, inferior orbital foramen, anterior superior alveolar nerve, lingual nerve, mental foramen, and Keek's nerve. Ventral aspect of the brain. Olfactory bulb, frontal lobe, temporal lobe, pituitary anterior lobe, optic tract, pituitary posterior lobe, mammillary body, sensory root of trigeminal nerve, pons, motor root of trigeminal nerve, medulla, cerebellum, occipital lobe. Olfactory tract, optic, ocular nerve, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, hypoglossal, spinal accessory, spinal nerve, spinal cord. Surface of the cross section of the spinal cord figure. Epidural space, subdural space, subarachnoid space. Pia mater, arachnoid mater, dura mater. Those are spinal meninges. Bone of vertebrae, dorsal root ganglia, bone of vertebrae. Cervical plexus. C1 and 2 are the segmental branches. C1, 2, 3, 4, and 5 is the ventral rami. And then the nerves are the hypoglossal nerve, lesser occipital nerve, greater auricular nerve, transverse cutaneous nerve, and cervicalis, accessory nerve, phrenic nerve, supraclavicular nerves. Top of the shoulder figure. So it starts with the dorsal scapula, then it's the nerve to subclavius, suprascapular, posterior divisions, and the cords are lateral cord, posterior cord, medial cord. The nerves is the axillary nerve, musculocutaneous nerve, radial nerve, median nerve, ulnar nerve. On the other side, you have the long thoracic, medial pectoral, lateral pectoral, upper subscapular, lower subscapular, thoracodorsal, medial cutaneous nerve of the arm and forearm. The arm figure. It starts in the box with the axillary nerve, that is the humerus, the radial nerve, musculocutaneous nerve, ulna, the radius, the ulnar nerve, median nerve, radial nerve, the superficial branch. Then it's the dorsal branch of the ulnar nerve, superficial branch of the ulnar nerve, digital branch of the ulnar nerve, and then the median nerve consists of the muscular branch and the digital branch. In the human figure of the shoulder, it's the musculocutaneous nerve, axillary nerve, radial nerve, median nerve, ulnar nerve. And on the other side is the lateral cord, posterior cord, and medial cord. Figure 13.8. It starts with the dorsal ramus, ventral ramus, spinal nerve, rami communicans, sympathetic trunk ganglion. Then there's on the other side is the intercostal nerve, dorsal root ganglion, dorsal root, ventral root, and the branches of the intercostal nerves consist of the lateral cutaneous and the anterior cutaneous. Then there's the sternum. Figure 12.8, the cranial nerves. It's the thalamus, infundibulum, mammillary body, ocular motor nerve, trigeminal nerve, the pons, hypoglossal nerve, decussation of the pyramids. Then there's the spinal nerves and spinal cord. On the other side, there's the optic chiasma, the optic tract, lateral geniculate body, cerebral pedicle, abducens nerve, facial nerve, vestibulocochlear nerve, glossopharyngeal nerve, vagus, and the accessory nerve. Clinical testing for nerves. So we're going to start with the function of the nerves. Olfactory is sensory, optic is sensory, oculomotor is motor, trochlear is motor, trigeminal is mixed, abducens is motor, facial is mixed, vestibulocochlear is sensory, glossopharyngeal is mixed, vagus is mixed, accessory is mixed but primarily motor, and hypoglossal is mixed but primarily motor. Cranial nerve number 1, olfactory. Ask patient to sniff and identify distinct substances. Examples is vanilla, lemon juice, and peppermint. Do each nostril separately. Optic nerve. Assess vision and visual fields with the eye chart and by testing the point at which the person first sees the object moving into the visual field. View fundus of eye with ophthalmoscope to detect papilledema, which is swelling of the optic disc, the site where the optic nerve leaves the eyeball, and examine optic disc and retinal blood vessels. This is for oculomotor, trochlear, and abducens nerve. Examine pupils for size, shape, and equality. Test pupillary reflex with pen light. Test convergence for near vision and subject's ability to follow objects with eye. And convergence is one of the 3 processes an eye does to properly focus on an image. Cranial nerve number 5, trigeminal. So for the ophthalmic division, it is the corneal reflex test. It is the touching of the cornea with wisp of cotton shed a length blinking. So if you touch it with a cotton, your eye should blink. Maxillary. Test sensation of pain, touch, and temperature with safety pin and hot and cold objects. Mandibular. Assess motor branch by asking patients to clench his teeth, open mouth against resistance, and move jaw side to side. Facial nerve. Test anterior 2/3 of the tongue for ability to taste sweet, salty, sour, and bitter substances. Check symmetry of face. Ask patients to close eyes, smile, and whistle. Assess tearing with ammonia fumes. Vestibulocochlear. Checking hearing by air and bone conduction using tuning fork. Glossopharyngeal. This is also for the vagus. Check position of the uvula. Check gag and swallowing reflexes. Ask patients to speak and cough. Test posterior third of tongue for taste. Vagus. The test for the vagus nerve is common since they both innervate most of the throat and mouth. Accessory nerve. Check strength of the sternocleidomastoid and trapezius muscles by asking patient to rotate head and shrug shoulders against resistance. And the hypoglossal nerve asks subject to protrude, which is extend beyond, and retract tongue. Note any deviations in position. Flow chart of brachial plexus. The roots is a C5, C6, C7, C8, and T1. C5 and 6 are upper trunk. C7 is the middle trunk, and C8 and T1 is the lower trunk. They all have anterior and posterior divisions. The anterior division of the upper and middle trunk give rise to the lateral cord. The posterior divisions of all 3 trunks, so the middle, upper, and lower, give rise to the posterior cord, and the anterior division of the lower trunk give rise to the medial cord. The medial cord gives rise to the musculocutaneous nerve. The medial cord and the lateral cord gives rise to the musculocutaneous nerve. The lateral cord and the medial cord give rise to the median nerve. The medial cord gives rise to the ulnar nerve, and the posterior cord gives rise to the radian nerve and the axillary nerve.